course. So like you said, I'm Erin Spiegel. I'm the Vice President of Clinical and Regulatory Affairs at PharmaJet. PharmaJet designs and manufactures needle-free injection devices. So these devices have been used pretty widely. They're commercially available, but most beneficially for nucleic acid-based vaccines. So, like I just said, the thing that excites me the most about our devices, being a geneticist by, by training and by my early work, is the impact that they can have on DNA-based vaccines in particular. So, you know, historically, DNA-based vaccines and therapeutics and gene therapies even have needed a vehicle or a delivery device or system, such as like electroporation or lipid, kind of like lipid nanoparticles. But our devices allow DNA-based technologies to be delivered without any of that. So no need for electricity. They're handheld. They can be used in remote locations in developing countries, that kind of thing. So the reach can be much bigger. So, especially with our intradermal platform, delivery of, vaccines or therapeutics intradermally, it really makes it basically pain-free, or it really reduces that fear of when there's no needle, there's really not a lot to be afraid of, and it being a small handheld device, especially children getting vaccinated, really kind of helps with that. In terms of manufacturing, we're pretty sustainable. We're manufacturing in two different countries, or two different continents, I should say, and with established high throughput manufacturing of our needle-free syringes. So the non-reusable portion of our system, plus our injectors themselves are reusable through 20,000 injections. So definitely very sustainable and very much more ecologically friendly than say a one-use larger needle and syringe. So it's interesting that the advances in nucleic acid technologies, and here, definitely both DNA-based and RNA-based. As we've seen through COVID, the RNA technologies are advancing very rapidly. But also with DNA, so the modifications that can be made to the plasmids and to the DNA itself, even eliminating, in some instances, the bacterial origins of replication, is just helping the cold chain portion of delivery, but also the bringing down the cost of manufacturing, which I think will, they'll all come together with the delivery to be able to make it vaccines just much more accessible. So we have a panel discussion, and it's basically what we've kind of just been talking about, is the delivery of nucleic acid vaccines, and specifically DNA, and kind of where we see and where the industry are advancing DNA-based vaccines and therapeutics, and how that's just really exciting for kind of the next stage of vaccine research, vaccine development, getting vaccines into the arms of people and children in every remote location everywhere, with not much trouble.